Hi, so I'm James Palmer. I'm the program lead for population health management in Surrey Heartlands. And I think the challenges or the health challenges facing the population in Surrey in many ways are the same as the health challenges facing integrated care systems across the country. So, like everywhere, we have an aging population, we have increasing demand on health and care services, and sort of budget increases that aren't keeping pace in that demand. And I guess a growing recognition that excellent clinical care, as important as it is to support the health of that population, actually on its own is insufficient. And actually, it's about trying to tackle the wider determinants of health and understanding the health of the population in general, and all the things that contribute to it, rather than just clinical services. That I think is the most important opportunity that we need to explore. Surrey does have a high life expectancy on average, and obviously that presents some particular challenges in the amount of comorbidities that we have to deal with, and perhaps a number of frail and vulnerable patients in that way that we have to deal with in some parts of our county. But like I said, in many ways, the challenges that we face are very similar to those elsewhere. And I think the great opportunity of population health and population health analytics is in working together to try and take that more holistic view of the population's health. We are fortunate in Surrey in that we have a public service reform directorate that, for the first time since last year and the creation of the integrated care system, brings together our public health, our county council, and our NHS information teams all in a single directorate. And I think that's a really powerful force that potentially can then look at understanding that population health more completely, and identifying, more importantly, the key things that we need to start to think about doing in order to address and improve that, and maybe meet some of that unmet need that will be challenging otherwise to deal with in the future.